Hello, everyone. Thank you for joining us. I'm pleased to introduce Erin Grease, who is a certified child life specialist within the Cardiac Intensive Care Unit at Children's National Medical Center in Washington, D.C. Thank you, Erin, for joining us. Can you please explain what the role is of a child life specialist?
Sure. So a child life specialist's main role in the hospital is to help children understand their diagnosis and any treatments or procedures that they may be going through on their developmental level, giving them a sense of ownership and ability to cope with their hospitalization.
Thank you. And I know you bring to this role training in many complementary and integrative care modalities and techniques. Can you share which ones you use within the CICU?
Sure. Depending on the child's age and developmental level, I sort of gauge that, but something that I've been recently using is guided imagery and pediatric clinical hypnosis are two of the new ones that I've been using. Also therapeutic touch and infant massage we're starting as well. Those are some of the new modalities that we've been introducing into the unit. Yes.
That's awesome. Can you explain a bit more what is each of those and what ages are appropriate perhaps, or do you use them only with patients or also with the caregivers?
Sure. So I'll start with guided imagery. So the difference between guided imagery and pediatric clinical hypnosis is that guided imagery is led by the caregiver or for myself, for instance, and we sort of guide the child to a very calm place. And pediatric clinical hypnosis is more patient-led or child-led. We help them get into a deep state of relaxation and then have them lead us where they want to go. And this gives them sort of an escape or control over the situation that might be happening to them. And really I use it as young as, 5 years old, especially guided imagery. It works beautifully. And also the real impact is that the caregivers get to see me modeling this with their child, and then they can also learn to do it with their child in the hospital or take it home. We have also a social worker here that we work closely with, and she does the hypnosis with the parents and the guided imagery with them. Yeah.
Oh, that is awesome. And can you share some of the differences that you've seen from the patient or the caregiver after you've utilized some of these different techniques and approaches?
Sure, yeah. I would say one of the most significant differences that I've seen is I had a patient with a severe needle phobia, really agitated, so anxious, and we were having to use a lot of medication beforehand to get that patient in a state where we could actually get an IV or any access that was needed. And we started with guided imagery and then moved on to some clinical hypnosis. And it was like night and day. The patient was able to get into a relaxed state, get themselves centered before we started IVs. And, it really changed the landscape of that for the patient and for the medical team. So, yeah.
Thank you very much, Erin. And we hope that you all have learned something new today and that you will join us for another conversation with a caregiver with Eliana's Light. Thank you.